I asked for physical therapy to come help me because I was a physical therapist, and I know that physical therapists come to help people in the hospital. And the nursing staff snickered a little and told me that PT doesn't come here, meaning they don't come to the OB floor. And I said, why not? Because I can't walk. And they said, well, they just don't come here. I, in that moment, knew that this wasn't going to work, and I was not the first person to experience this, and how sad it was that there were women out there that this was continually happening to. And I am a person who doesn't sit well with knowing that other people are suffering, so I wanted to figure out how to make it better. I'm Croghan. I'm a doctorate in physical therapy. I specialize in public health and obstetrics, and I work in an outpatient setting. It's a long story, but I started because, I had my daughter. I had her at a hospital down in Denver, and my postpartum journey right after I had her was incredibly painful, and I couldn't get out of the hospital bed. I couldn't roll over. Couldn't sit up. I was in so much pain. And then when I was able to stand up, my blood pressure would drop and I would almost fall. So I wasn't even able to walk to the bathroom, let alone walk to a bassinet in the room to get my baby. So when I had my baby was breech, and I tried really hard to find a provider who would assist me with a breech birth, and I couldn't do that. So I just showed up at a random hospital in labor and labored for a while before consenting to a cesarean. And so I had a cesarean birth with her. She was fine. I was not fine. My abdomen was in so much pain because of my major abdominal surgery, and I didn't have any sort of the binder or anything to help support my abdomen. And I was sitting up in a bent position in the bed for a day before I went to go stand up. And as a physical therapist, we all know if somebody has a knee replacement, they should not have their knee in a bent position because they won't be able to get it straight. The same thing exists with the abdomen and scar tissue. So I knew better as a PT, but in that moment in time, I wasn't thinking clearly on that. So then when I went to go stand up, that scar tissue that had already started forming and a very large abdominal wound, it was incredibly painful without any abdominal support, like a binder or anything like that. I asked for physical therapy to come help me because I was a physical therapist, and I know that physical therapists come to help people in the hospital. And the nursing staff snickered a little and told me that PT doesn't come here, meaning they don't come to the OB floor. And I said, why not? Because I can't walk. And they said, well, they just don't come here. I had a walker. After about 3 days, when I could stand better, because I had a reaction, I think, to the anesthesia that made my blood pressure continually drop so that I would faint. I did not leave that hospital room for about 3.5 days. And then the nursing staff gave me a walker, and I walked by myself with my husband and my baby, him holding the baby, down the hallway without having my vitals monitored as I walked. And I joke around with acute care PTs a lot, but they're really good at walking people. And I didn't even have them there to walk with me and make sure I did not fall. So it took me about a half an hour to even make it down the hallway and come back, because I had to stop taking breaks, and because it was really painful. But I wanted to get out of that room. I, in that moment, knew that this wasn't going to work, and I was not the first person to experience this, and how sad it was that there were women out there that this was continually happening to. And I am a person who doesn't sit well with knowing that other people are suffering, so I wanted to figure out how to make it better. Now we have a program where we see moms when they're pregnant, And then we see them in the hospital. Acute care PT goes in and sees them day 1 postpartum. And then for all moms who've had a cesarean and moms who've had a vaginal birth. And then we see moms in the outpatient 1 to 2 weeks postpartum. We try and get as close to that week 1 postpartum as we can. And then we continue seeing them as needed, depending on their functional limitations and their activity restrictions. And are they able to walk? Are they able to pick up their baby? Are they able to care for themselves? Just like any other person that leaves the hospital, we sit and we talk with them, and we want to know how many stairs do they have to get in and out of their house? What sort of things do they need to get back to? And we just don't ask these questions to moms postpartum. We are discharging them home, and they don't actually get to take care of themselves. They have a baby that they have to keep alive. So their focus is more on the baby. So I think that that's part of what we really need to understand is cardiovascular changes that take place, and that just because they're no longer pregnant, that doesn't leave them not prone to other cardiovascular conditions like blood clotting or preeclampsia or HELP. So doing postpartum home visits has been interesting because an aha that I've had is looking at their home situation and really realizing how much they are doing. And I know that I did those things postpartum, of course. I just figured that was just me that was always overdoing it. But the moms go home and they're overdoing it. And it's been slightly scary for me to be there and maybe check their vitals and see, oh my goodness, you are getting a little too high in your blood pressure when you do the stairs. And that's scary. Nobody would have known that before. So how many near misses have we had? And so far, we've just been lucky enough not to lose anybody. Mom's feedback has been exponentially grateful. They're so happy to have us there and have us come and just check on them. I hear from moms a lot that everybody's here to check on my baby, and you're the only one that's come to check on me. And I believe very much in treating the mother, because the mother, if we show her love and kindness, she's going to show her baby love and kindness.